How would you feel if you had to stick a needle in your belly every day to give yourself an injection just to survive? For many of diabetic patients, this is their reality. Diabetes occurs when the pancreas no longer functions properly to secrete insulin, and insulin is an important hormone to lower your blood sugar. There are 3 types of diabetes. Number 1 is juvenile diabetes, which is usually childhood onset, and then there's adult diabetes, which is called diabetes type 2, and then gestational diabetes, which occurs during pregnancy, which usually goes away after the baby has been delivered. This information is all from the Centers of Disease Control, and you can find this information at the cdc.gov. The goals of living with diabetes is number 1, to control your blood sugar and make sure they stay controlled, maintain a healthy weight, and then prevent further complications. Ways to control diabetes is, of course, diet and exercise. Weight loss is key if you're overweight. Even the smallest amount of weight loss, even as little as 5% of your overall body weight, can significantly lower your blood sugars. Another way to control your diabetes is anti-diabetic oral medications, and then insulin. And insulin is usually used as a last resort because it is so strong. Even the slightest error in insulin could be fatal. Signs and symptoms of abnormal blood sugar without actually checking your blood sugar are called hyper and hypoglycemia. Hyperglycemia is when your blood sugar is too high, and symptoms are polydipsia and polyuria. Polydipsia meaning excessive thirst. No matter how much you drink, you just feel like you cannot get your thirst quenched. And then polyuria, which means you're just constantly urinating for no apparent reason. And then hypoglycemia is when your blood sugar is too low. And the main symptoms of that are confusion, feeling lightheaded, feeling grumpy, and then fatigue. So those are just some signs and symptoms to know if your blood sugar is out of range. Ways to know if your blood sugar is controlled. The main way to know is check your blood sugar. It's usually recommended to check your blood sugar twice a day, usually once in the morning before you have anything to eat or drink, and then 2 hours after dinner. Another way to know if your blood sugar is controlled is a test called a hemoglobin A1C. That's a test that gives you a blood sugar average over the course of 3 months. And then it's very important to know the normal ranges. Fasting blood sugar before you have anything to eat or drink is 65 to 110. And then 2 hours after you eat, your blood sugar should be 65 to 140. And then a hemoglobin A1C should be less than 6.5. And all of this information was taken from my textbook of medical surgical nursing. Complications of diabetes, if it's left untreated, are heart attack, stroke, kidney failure, neuropathy, and that just means numbness and tingling, usually found in the legs and feet, which can lead to amputations. Diabetes can also affect your eyes, which could cause blindness, and then if left untreated long enough, diabetes can ultimately lead to death. All of this information was taken from the American Diabetes Association, and you can find this information at diabetes.org. So again, the goals of diabetes is number 1, control your blood sugar, maintain a healthy weight, prevent further complications, check your blood sugar consistently, take all of your medications as directed, and as always, follow up with your healthcare provider.